Healthcare is changing, and Dr. Nancy RN is here for you. The topics are many, but each program stands on its own with 3 key action points for you to learn. Your guide to a healthier you in a changing world. Dr. Nancy RN.
Welcome to Dr. Nancy RN, Healthy World, Healthy Nation, Healthy You. I'm Nancy Valentine, PhD and registered nurse, and this show is dedicated to you, the healthcare consumer. And today we have a show that I know you're going to enjoy, especially if you're getting older and you're concerned at times about what you are eating or what you are not eating. The title of our show today is Eating Your Way to Aging in Place. That means staying at home. The impact of nutrition on maintaining your health. And why we think this is so important is that many older people do not realize the association between good nutrition and good health outcomes is really very important, and they are closely associated. So why we entitled this Aging and Eating and Aging in Place is because you want to stay home. You don't want to have bad outcomes and have to go to a nursing home, primarily because your nutrition is a big factor in your poor health. So we're going to be talking to you today about how you can maintain good health through food. So we're going to be talking about weight loss among elderly people. The intentional weight loss, because you may want to lose some weight, or the unintentional, meaning that you're losing weight because you do have poor and inadequate nutrition. We're also going to be talking about the tea and toast syndrome, which often people get into because they want something light, but they're really not having protein in their diet, and we'll talk about why that is so important. And then lastly, we'll be covering the fact that food is indeed medicine. So often when people are older and they're focusing in on maintaining their health and following their healthcare regime, they focus on taking their medication, and maybe less so on food. And we're going to be talking about how your food and what you are consuming at your mealtime is as important, if not more so, than some of your medications. So really, to guide us through this discussion is another nurse PhD RN, and I would like to introduce Dr. Rose Ann DiMaria-Ghalili. Thank you, Rose Ann, for being with us today.
Well, thank you, Nancy. It's my pleasure for being here today as well.
It's great. Let me tell you something about her. She's got a really fantastic background. She is a nurse that was working in, as she will tell you, in acute care, and got very interested in nutrition support in hospitals. And so she then took on some additional training, where now today in her work at Drexel University College of Nursing and Health Professions, she holds an appointment both in the School of Nursing, and she works with the nutrition department as well. So she really has a combined interest, and in that setting she's really able to put it to work by affiliating with the nutrition department. So I think that being a certified nutrition support nurse, which means she did a lot of hands-on clinical work in the hospital, really gives her the knowledge base to help you impart this information and give you some tips. She also has done research, and she has done a lot of publications, and she's going to walk us through some of her work today. So again, Roseanne,
oh, thank you.
It's great. So tell us, I mean, just to really get going, how did you as a nurse really decide to focus in and become a specialist in nutrition? Something must have really caught your attention.
Well, actually, nationally, there's a certification called Certified Nutrition Support. We used to have nursing, but now it's clinicians in general. And these are nurses that are interested in nutrition across the lifespan.
Okay.
And we focus a little bit more on TPN and tube feeding, but good nutrition is always included in part of the criteria in the assessment. How I got started down this path was I worked in the ICU for many years, and back in the 80s we were starting a nutrition support team, and I was invited to be part of that team and help coordinate the team. With budget downsizing over the years, there's been a lot less nutrition support teams around, and the role of the nurses on those teams have sort of been taken up into either staff ed or into wound care or IV therapy, but there's still a cadre of nurses very much interested in nutrition support, and we do have our own standards of practice as well.
So does that mean that there really are less support services in hospitals around nutrition for patients?
Yes, as a formal team, there are less formal nutrition support teams around today. But obviously, you know, the role of the clinical nutrition department with the dietitians, they play the large portion of nutrition services in the hospital.
I think that for those of you who are watching that are clinicians, whether you're nurses, physicians, social workers in the community, perhaps case managers, there'll be tips for you as well, because I think that what we're hearing Roseanne say is that there may be less formalized services in hospital settings. So that means that a lot of this work really has to be taken up by other clinicians. And so the more that you are aware of some of these factors that we're going to be reviewing as well will make you just that much more valuable to the patients that you're serving.
Right, and what's really interesting and timely is we will be publishing a supplement in one of the journals, the American Journal of Clinical Nutrition. The National Institute of Health actually had a big summit on the role of nutrition across medical education and health professions recently in 2010, and I was part of that summit. And it was, all the disciplines got together at the table to say that we need more nutrition in our training, whether you're a physician, nurses, pharmacists, and we need to be able to work together collaboratively and interprofessionally around nutrition issues in people, as we're going to focus today on older adults, but across the lifespan.
So that supplement is not a nutritional supplement, that's additional information.
Correct.
That's going to be published in what journal again?
The American Journal of Clinical Nutrition.
Well, I think for those of you who are clinicians listening, we'll make sure that that's on our website so that people that are in those fields will be able to access that as well.
Absolutely. Great, thank you.
But for our consumer listeners, let's talk about what you saw in the hospital that again really spurred you to become a specialist in this area.
Well, I became interested in studying nutrition in older adults because it was really quite amazing in the ICU. You would see I worked in the Bronx, and at the time it was a very high crime rate, and we had a lot of trauma in our institution, and we would see a lot of young trauma patients come in with gunshot wounds. Their abdomen would be open, they would be rerouted, and we would have them on special IV nutrition. And they would do well. It didn't matter how many surgeries they had, how many gunshot wounds they had. They would just walk out of the hospital. But an older person, maybe in their 70s or 80s, walking across the street, gets hit by a bus, would linger on. And it would just take forever, their recovery process. So I became very much interested in the role of nutrition in recovery in older adults, especially as they underwent surgery, to see how we could improve their health outcomes by providing better nutrition.
So I think most people listening to that clinical example, Roseanne, would say that, gosh, you would expect a younger person, even if they had traumatic injuries that you just described, because they're younger. And you're saying people that had traumatic injuries, maybe not gunshot wounds, but something traumatic like being hit by a vehicle, they would have had a chance to survive, you think, but you thought at the time that nutrition was a decisive factor.
Right, and so what was really interesting was the high prevalence rates for malnutrition for older adults in the hospital. And the studies have shown that this is somewhere between 20 and 70%. So I was really worried about that number and wanted to know, is it something, do older adults, do they come into the hospital with malnutrition? Is it something we do while they're there in the hospital? And more importantly, what happens when we send people home?
Well, I think that's really a very good point right there, because obviously you don't know when something could happen where you would have a traumatic incident, or you would fall, or you would get sick. If you really start your course of treatment being already malnourished, you're really sort of behind the curve to begin with. So even all things considered, even if you feel like you're doing pretty well, nothing really bad is happening to you right now, this is really a good show for you to think about, because the better you can reinforce your nutrition and maybe move it up another level or two, you're really helping yourself in case, it's almost like an insurance policy, in case you have something that is really serious.
Correct. And we say that insurance policy, we say when people age is the physiological reserve, like they don't bounce back as quickly. So that if you do undergo a critical illness or acute injury, and you don't have enough nutrition on board, so to speak, right, or good reserve, that stress of the illness could begin to impact your nutritional status and your overall well-being. One of the big problems we see is this loss of muscle mass. So we begin to break down muscle, either if we're just lying around in bed and we're not moving, or if we're very stressed and our body needs the protein for fuel and we're not eating enough protein. So the real reason why this is a problem is if we lose our muscle, then we're going to have poor functional outcomes. We won't be able to walk. We won't be able to take care of ourselves. And eventually, this functional demise will lead to disability, and people will not be able to go home, and they may need to go to nursing homes or rehab centers to recondition themselves so that they could take care of themselves again.
Right, very good point. Well, our first key point, Roseanne, is really about weight loss. I mean, some older adults are a little chubby and they want to lose some weight.
Correct.
And then there are others that are losing weight because they're not eating well. But in both of those instances, how would you advise people to handle that?
Right, so that's really a good point. And weight loss, whether it's intentional or unintentional, the big concern in older adults is that when you lose weight, you could also lose protein or muscle. So if you're really on a very strict weight loss diet and you want to lose weight, then what professionals advise is that you incorporate strength training exercises so that you preserve the muscle mass and that you can then lose weight safely. So we don't want people losing weight is great if you're losing fat, but if you're losing your muscle in addition to the fat, that's not good. And we talk a little bit about what we call, and this is a medical term, we call it sarcopenic obesity, so that even people who are obese can have this chronic inflammation where they're wasting protein and muscle mass, so that even with weight loss in that group could have a negative impact if they're not preserving the muscle.
Right. I think that's an issue for anyone that's losing weight. I mean, that's not only for older adults, because anyone that's losing weight, one of the reasons you hear it's not good to go on a crash diet is that crash diets tend to be so low in calorie, or they're calories that are not coming from protein, which is meat, fish, legumes, other kinds of beans. We'll talk about what are high sources of protein as we move along in this. But I think that is bad at any age, but it's only accentuated when you're older.
Absolutely.
And so we're really talking about how you can train as an athlete given the fact that you are older. So what Roseanne is saying is that if you are on a diet, you also have to be on an exercise regime. You have to do weight lifting of small weights, something that someone can advise you on what you can do, because that will help you while you're losing calories keep your muscle. And this is really an important point.
Absolutely. And I can also, we'll have some information on the website. The National Institute of Aging has a really wonderful fitness regimen for older adults. It's Get Fit for Life, and it shows really simple examples of how you could do strength training and balance exercises in the home. Even if you don't have weights, they show you what kind of props you can use around the house, like cans of soup and things of that nature. So, and it's free, it's on the internet, and it's a great learning tool, self-help tool.
That's really great, because a lot of older people are not going to have the money to go to a gym.
Correct.
Or to hire a trainer.
Correct.
They really have to be improvising at home and finding things that are really right at your fingertips, but using them in new ways. How about your point about the tea and toast syndrome? Tell us what that is.
Oh, well, so the tea and toast syndrome, we talk a lot about malnutrition in older adults, and there's a lot of risk factors that happen as we age that can set someone up to being at nutritional risk. And one of them is, of course, decreased appetite, not early satiety or getting full quickly. And we hear a lot about tea and toast. Oh, what did you have for breakfast? I had tea and toast, just something light, because I'm not that hungry. But the problem is, if you have tea and toast as one of your meals or two of your meals per day, you're not getting enough calories, and you certainly won't be getting enough protein that you need. So this is what sets people up for this unintentional weight loss, especially if this is all that you're taking, this light amount of food. And we really need to think about how many grams of protein people do eat. And I don't want to start giving recommendations or numbers out there. There's been one school of thought that said that protein needs don't increase as we age, but there's more evidence coming out from experts that say that as people age, they actually need more protein. So you need to think about how much protein you're eating, and it's very hard to get if you need 60 or 70 grams of protein in one meal. So sometimes it's easy to separate that out during the day. And if you're only having tea and toast, there's not much protein in that.
So I think what you're saying is if you're having tea and toast, you really can't call that a meal. Correct. That may be a snack.
Correct.
But you really can't count that as a meal, because
Absolutely.
no matter how you're counting protein grams, which most people wouldn't have a clue as
Correct.
to what that really means. But we're going to really try to give you some idea. Tea and toast is just not going to cut it.
Correct.
So show us some of your visuals in terms of how people can have a picture of what they should be doing.
Absolutely. So we'll just start with this. We usually, when we talk about grams of or serving size of protein, this is a deck of cards, or they say the palm of your hand. That's a 3-ounce serving of, like, if you were having chicken or fish or steak or something like that. So you know, if you have a huge steak, that's the problem with Americans, is we supersize everything. So if you have a big porterhouse steak for dinner, you're having all your protein pretty much in that one meal. And what some of the work coming out is saying that our muscles as we age do better if we have protein divided during the day.
Sure. I mean, I think that makes a lot of sense.
Yes.
I think when you go out to a restaurant, you can certainly ask for a takeaway and take some of that home with you, and you may actually get another meal or two
Absolutely.
out of some of these servings. But if you use that deck of cards and your microwave, that's at least a beginning way of measuring, correct?
Absolutely, absolutely. And if we go to the visual on the plate, you know, the government always talks about the we used to have the food pyramid. The government used to recommend that that's what Americans should follow for a healthy diet. Then they came out with MyPlate, and Tufts really put this visual out, MyPlate for older adults. And what you see is this is what we should have for every meal. When we sit down to eat our 3 meals per day, this is what we should have. And for older adults, half the plate should be on the left-hand side. You'll see half of the plate should be filled with fruits and vegetables.
Right.
Okay.
I think that we should really spend a moment trying to help people walk through this, because this is not immediately apparent, at least not to me, in looking at the plate. But I think, as Roseanne is saying, if you look at that plate, it's really cut in a half, and then the left hand is all the fruits and vegetables. So they're trying to show that visually. And most people don't have all those servings of fruits and vegetables every day. That's as hard to factor into your diet in some ways as the protein.
Correct.
Now, is there protein in some of that visual?
Yes.
Let's look at that again.
In the lower right-hand corner are your proteins. So you see, there's your servings are typically, you know, your chicken, meat, and fish. There's eggs there. There's yogurt, cheese, legumes, as we said earlier. So you could get your protein from a variety of different sources.
Right. And then what's at the top
and
right?
Up at the top are your wheats.
Okay.
Your grains. So you should have enough servings of that. And in the upper right-hand corner is fluid. Older adults are really at risk for dehydration, especially in hot weather. And, you know, I know if people have heart failure, they may be on a fluid restriction. That's one thing. But we need to really focus on how much fluid people take in as well. And in the upper left-hand corner, which is very much different for the rest of the general population, is exercise. You see, that's what that's all about, is walking. sharing your meals with people, because one of the risk factors for malnutrition in older adults is loneliness and isolation.
Right. So they're trying to get everything in that one.
That one visual.
Okay, that'll be on the website, so you
Yes.
you can copy it off and hang it on your refrigerator. But it sounds like one way to really plan this, because this does take a lot of planning for
Yes.
folks, is to really think of some exercise every meal. So whether it's walking or doing your holding your cans and doing your weight bearing.
Right.
Something where you're having some exercise that you're thinking about, which is more than what you usually do. 3 times a day, maybe in small bursts.
Right, absolutely. And it could also be, and some of the information we'll provide is also about maintaining your strength training so that you prevent falls, which is also a very big issue in older adults as well. So it's really all tied together.
Right. Okay, well, thank you for that visual, because it does give you somewhat of a snapshot of what is the guideline.
Correct.
Okay. So then tell us a little bit about the food is medicine concept.
So we need to really think a lot about food as medicine, because let's back up a minute. If we think about someone being sick and being in the hospital, we provide them with their medications, we give them food that they need, and what do we do when we get ready to send people home? One thing that we do is we say, okay, this is a list of the medications that you need. Make sure you fill your prescriptions. We talk about diets, but that's all that we really talk about. If the social worker is lucky to come by and see a patient in the hospital, maybe the social worker will ask the patient, do you need any help with meals at home? Oh no, I'm fine. But if you've been if you've had the flu, do you even feel like cooking for yourself? So could you imagine if you've been in the hospital any number of days, you have some deconditioning, and then you go home and there's nobody there in the house to help you? Did you have food in the house to begin with before you even left before you got into the hospital? How good is that milk anymore that's in the refrigerator? So we set people up not to be successful when they leave the hospital, and we need to think about food as being medicine, that they need healthy, nutritious meals when they go home. There are programs like Meals on Wheels in the community to help people provide the meals that they need if they can't cook for themselves at a certain point in time. Some institutions around the country are starting to send people home with prepackaged meals. Like as when women have babies and they're pregnant, have babies and they leave the hospital, they give them a little bag of diapers and other goodies to try out. Well, some hospitals are actually sending patients home with prepackaged foods. So I think we need to really think about using food as medicine. In that regard, is that people need to eat a nutritious, well-balanced meal 3 times a day, especially during that recovery period when they're transitioning from the hospital to the home.
Right. I think that this is really a great point to summarize, because what you're saying is that older people really need to pay a lot of attention to their food.
Absolutely.
And this is a problem. There are socioeconomic barriers for some people. There's access, like they don't live close to a store to get their food.
Absolutely.
Some people have vision problems, so it's more difficult for them to prepare their food. Or there's the psychosocial issues having to do with loneliness and depression, so they really don't feel like making their meals. These things, what Roseanne is telling us, is really vitally important. And I would say most health professionals skip over this. If the truth be told, they really don't spend a lot of time on this.
Absolutely.
If you, as the patient, say, oh, I'm fine, they just check off fine. Whereas, as she's saying, your medications, because they are complicated in many cases, people tend to spend time, they go over the details. Whether you really understand it or not is a whole other issue. But they do spend time as part of the discharge planning process to go over that. But what I hear you saying to everyone, to the consumers and to the treatment teams, this really has to be front and center. This is really important.
Correct.
Because if you're not in a good nutritional state, The other thing that we haven't talked about is your medication isn't going to work as well either. It's assuming that you've got balance in your diet, that you've got what they call electrolytes, and you have enough fluid, and all these things are in balance because you're eating the foods that you saw displayed on that plate. But if you're not, and you're losing muscle, and you don't feel well, your ability to get better is really compromised. And I think going back to that early example that you gave in the hospital, where it sounds at face value like if people are in and they're young and they have gunshot wounds, it's amazing they get up and leave the hospital. I mean, that is amazing, but nonetheless they do. It's amazing how they do. And then you've got the older adults who maybe had something that could have been a good outcome, but they don't. They're in the hospital for long periods of time. They get a lot of support services, and sometimes it doesn't make a lot of difference because they are so compromised from not just an aging process, but from a nutritional standpoint. And a lot of people don't recognize that. And I think that's really the point you're getting across here today.
Absolutely.
So if you were to really give people some tips, and you really wanted people to walk away from this show with a few things that they could do right now, what would you advise our guests?
Well, if you were a family member taking care or who had an older parent, I would ask you to stop for a minute, because we are living in a global world. Not everyone lives near each other.
Correct.
And we have a little checklist that I'm not sure if the visual will show up or not.
Yes.
Okay. So, and this is up on the website. And this was, it's called the Determine Your Nutritional Health Checklist. And these are really just some reminders of what we should consider, some of the risk factors. And I'll walk you through it. It's up on the website. One thing is, do you have an illness or condition that made you change the amount or kind of food that you eat? And if the answer is yes, then you need to say, am I getting enough nutrition? Am I eating properly? What can I do? Maybe I need a consultation with a dietitian and to help me prepare a better diet, have a better diet. Do you eat fewer than 2 meals per day? And if you really need to ask yourself that, well, if I have tea and toast and then I have lunch and dinner, that's really 2 meals per day and a snack. Tea and toast doesn't count as a breakfast. So that could put you at risk. And you need to think about how you can incorporate 3 meals per day. Do you eat few fruits, vegetables, or milk products? And again, we need to really think about that, and including a wide variety of products. Alcohol. 3 or more drinks of beer, liquor, wine, or alcohol per day could be problematic. We know that too much alcohol can impact our vitamins, or nutrient status as well, and that can put us at risk. So you need to think about that. What kind of help do you need with that? Tooth or mouth problems. We didn't touch on that, Nancy. That could be another show.
Well, we might do that.
Because, what happens is that as we age, as we live our life and we work, we have dental insurance. Medicare does not cover dental insurance, right? So if people, as they age, have tooth or mouth problems, they may not have the health benefits to go to the dentist.
Well, you can see that there are a lot of things on this checklist, and we have covered a lot today. And I want to really thank Roseanne for really giving us those tips, because these shows never really cover every part of the topic, but we really want to give you a heads up, because in the whole scheme of things, nutrition is something that you can control. If you pay attention and really put your mind to it, you really are able to really make some progress for yourself. And that progress could be the difference between living comfortably at home and being well and sort of gliding through your life in these older years, or it could be the decided difference where if you get sick and do go in the hospital, it really will contribute to you not getting better. But if you're in good nutrition, it will contribute to you getting better a lot faster and being successful in returning to home. So again, we've really covered, I think, these areas of nutrition, how to lose weight in a very organized way where you don't lose muscle mass. We've talked about how to have 3 good meals a day so that you're getting enough protein, and how for you to reframe eating as part of your medical regime, that this is medicine for you and not just something that you can just not pay attention to. So again, I hope you've learned something from this show. Roseanne has been a great guest for us.
Thanks
She's given
for having
us a lot of really helpful tips. And I want you to remember that with health, all things are possible. Have a wonderful day. I hope you enjoyed our conversation today and that the information will help you in meeting your health goals. Catch this program and other conversations on the website, drnancyrn.com. Or you can write to me as well. I welcome your comments and feedback. Thank you for listening, and join us again. And remember, with health, all things are possible.